Hey, how are you? I believe you're doing fine. Okay, I want to give you information concerning pelvic inflammatory disease and how you can actually identify if you have one. Do you understand? So do you want to know if you have PID, pelvic inflammatory disease, and the signs that are associated to it? Today I'll take you to this very journey of understanding what it takes to actually get this information or how you can actually manage it. So now, if you are having some signs, I want to mention about 7 signs in your system. You have to do well to go and meet your health providers to tell them what you're actually observing in your system without sitting at home just on your own. All right, if you're having issues that has to do with low abdominal pain under your abdomen, if you are having any issues there, those pains you're having there, those pelvic pain, could be associated to PID. Once you're having this sign, you count it number 1. Do you understand? Not actually all the pains under the abdomen is actually associated to pelvic inflammatory disease. So as I'm giving you the information, you're picking it out. Once you are having those issues that has to do with abdominal pain, you pin them down. Then if you're having abdominal discharge, if you're having some abnormal vaginal discharge with some unpleasant odor, so know fully well that it could be associated to PID, then you mark it number 2. So certain discharge you are having in our vagina have actually discharged the difference between normal discharge and abdominal discharge. You can go down and then listen to it and know what is actually associated to it, know what actually triggers it, and understand it for yourself. So it will help you so well to clear with anything that has to do with uninformed issues associated to pelvic inflammatory disease. So we are talking about the abnormal vaginal discharge that could be unpleasant or having some fishy odor and the rest of it. Know fully well that is associated to PID. Most time is equally associated to level of darkness which is mixed up with blood. So if you're having this issue, just consider it an information you have to give to your healthcare provider so that he will help you in issues of diagnosis of PID to help you clear yourself. Then if you're having painful urination all the time, any painful urination that you're having, that when you're having it, it seems as if that the bladder is being drawn down, as if that you're having some sensation that you cannot explain. Once you're having those painful urination, when you're urinating, having a lot of pain and pressures down there, you have to take it number 3. If you're having irregular menstruation, having irregular bleeding, do you understand? Bleeding in between the periods, if you're having it, you have to run so well to your healthcare provider to give this information to him or her to be able to help yourself. As well, if you're having a heavy bleeding on its own all the time, it could actually be associated to PID. If you're having, I've seen PID case that has last a woman bleeding, just bleeding profusely with just having those heavy bleeding on her system, on her panties, always on her pad, morning and night, always having a heavy bleeding that has actually led her to she's going to TB Joshua and the rest of it. Before I came in contact with her with the information, someone actually drew her attention to myself, and herself and her husband was able to visit me, and that issues were cleared. Do you understand? PID has a lot. PID can actually cause a lot of traumas on somebody, especially when it's unidentified. So if you're having issues concerning this associated to this, run and take care of it before it becomes too late. Then if you're having fever and chills, when you're having fevers and chills, those are something you have to count again as signs always associated to those PID. So painful sexual intercourse as well is another thing you can actually see when you're having intercourse with your partner, having intercourse with your husband, you can actually be feeling a lot of pains down there. And on that note, just know that you have issues with PID indirectly. So again, we'll talk about that unusual bleeding that I've actually made mention of. Once you're having unusual bleeding, maybe you don't see your menses this month, you did not see it the next month, the next thing, it will actually fight up, to actually run down and keep coming on its own. It dries on its own, it comes. You can actually identify when your menstrual cycle is about to come or not. Once you're having this constant issue, you have to run to your healthcare providers. You can actually ask us questions. We can actually give you some help. We can actually address certain issues for you, and you'll be able to take charge of your health from home. Don't forget to call up all those very tips that I've just mentioned. I've just mentioned the issues that has to do with abdominal pains, the abnormal vaginal discharge that you're seeing that is so unpleasant, that unusual pains you're having during urination, that irregular menses that you're seeing, the heavy bleeding attached to it, the period that is coming in between the cycle, the pains you're having during intercourse with your spouse, the fever and chills that is associated to it. Please, once you're having this is just a sign that actually shows that you're having some pelvic inflammatory disease. This is their symptoms. So once you're having it, just run and give this information to your healthcare providers, and you know that the journey of fertility is always embracing, and it has already been cleared. You enjoy every part and times of your pregnancy without having miscarriage on the way. Thank you. I believe this information has a lot for you. I believe this information has given you a lot of information. Thanks for subscribing. Thanks, because I know you have to comment and like this very video. Thank you so much. We have a lot of energies here. We have a lot of things to actually pour to you, and it will make you take in charge of health. Don't forget, we are CC Natural Therapy, and we are always there to answer your questions and informations you need on your decks, in your home, that right there in your office. Thank you so much.